Hi, good evening. Thank you very much for attending our event. I know it's hard to travel during this time. Also, I much appreciate our international speakers and guests to come to Dubai to be with us. And first, I want to introduce Dr. Roberto Di Lavandaco and invite him to come to the podium.
Thank you so much. Thank you so much, Marina. Absolutely, thanks. So for me, it's a great honor and privilege to be here, absolutely, and invited by the Cutec Cosmetics. And but mainly, I'm very honored to have here some of the maximum experts in plastic surgery and cosmetic medicine from all over the world. So thanks so much to be here. And I would like to introduce myself. I'm Dr. Roberto Lavanzato. I'm from Italy. And in 2005, I invented Endolift. So Endolift is something that can be considered nowadays something that could be used in many different fields of medicine, surgery, and even in synergy with different techniques that later I'll show you on. The first experience that regarding the tightening of the tissue of laser liposuction comes from the Dr. Affelberg in '94, and the first publication comes in '96. So in 2006, the American FDA want to approve it, want to check if the laser can improve the result of liposuction. So they, in 2006, they did an international study where they perform and they check how the laser can increase the result of the liposuction. So the question was if the addition of laser could spur tightening of the skin. So the researcher involved 2,200 patients, and they are checked if the laser can increase the quality of the result in tightening. The result counts that the amount of skin tightening with laser liposuction is probably about 50% better than what would have been achieved with traditional liposuction. In the same study, they suggest and they confirmed also that the fat cells absorb the laser energy better than other energy, like radiofrequency and ultrasound. So if you want to perform a liposuction with the tightening of the skin, the laser from 2006, the FDA says that it's the best energy to treat these things. And why? The wavelength that we are going to use is the 14,000 nanometer. So the 14,000 nanometer have this higher absorption for the water and fat for the yellow. So no other color, other targets are in this wavelength. That's important because if you use a lower wavelength, you can have different target for example, the black, for example, the red, and the rest. Another thing is the infiltration. So local anesthesia during the laser liposuction can increase the result. Why? Because we have more photothermal effect, more photomechanical effect, so we have more emulsification of cells. If you want to compare the effect of wavelength on the fat, there is the study that demonstrates that higher is the wavelength, higher is the effectiveness, but we can reduce the watt. So the power can be reduced and the risk of thermal damage can be reduced for sure. But at the meantime, the thermal diffusion on the skin is lower when we increase the wavelength. So using the 14,000 nanometer, we can say that we are going to use the correct wavelength to have not risk for the skin damage, but effectiveness for the fat destruction. The devices that we are going to use is the diode laser for the 14,000, the optical fiber that are used for the laser liposuction, specific liposuction cannulas. For example, for the under chin, we are going to use the 1.2 millimeters cannula, so a very thin cannula that can be used for that area. there's something interesting. There is a study that comes from Israel that analyzed the quality of the fat removed by the classical liposuction and the fat removed from the laser liposuction. So they perform 10 patients, one side with classical liposuction and one side with the laser liposuction. And at the end, they demonstrate that the quantity and the quality of free adipocyte alive in the laser harvest samples is 95.7%. Instead, the quantity of free adipocyte alive in the mechanical harvest samples is 79.7. But there is another variable. Is plus minus 2.7 for the laser and plus minus 18.3 in the mechanical liposuction. This means that the quality of the fat that we can transfer, remove it with the laser liposuction, it's absolutely better in quality and predictable in viability respect the classical liposuction. So this is another good thing that we can even consider where we are performing the laser liposuction, because we can use the laser for different things. Later we can see where. So in my experience in the last 16 years, the classical liposuction is not anymore performed, and I use always the laser liposuction. There is a less trauma, it's a faster procedure, less pain, edema, hematoma, smaller incision. For example, for here, the cannula is 1.2 millimeters, so it's very, very thin, and can be used also to correct the classical liposuction technique. Starting from this experience, 1 year before the FDA approval, I thought to treat some areas of the skin, of the face and the body, just with the naked fiber, performing the endolift technique. So the first time that we're talking about the endolift technique was 2005, the first congress was 2007, and in 2009 comes the new wavelength, the 1470 nanometers. So we are going to use the device and the FTF fiber. The fiber are sterile, so single use, and are microscopically lapped. Lapped means that the surface of the fiber is very smooth, so can pass easily inside the skin. This is the technique, how you know that when we want to improve and we want to perform a skin tightening, there are mainly three different techniques that can be evaluated. For example, radiofrequency, laser, and deep tissue ultrasound or microfocus ultrasound with vision. And the radiofrequency, unfortunately, doesn't reach more than 55 centigrade Celsius. So we know that the threshold for collagen denaturation is about 55 to 60. Again, the Hayashi, in a study in 97, demonstrate that at 65, not before, there is the collagen remodeling, the collagen denaturation that starts to achieve the best result. And slightly increase until 70 degrees, but over 70 degrees, there's no difference and there's no needing to go to the higher temperature. So the right temperature is between 65 and 70. Again, in another study in 2005, Lin demonstrated with histological studies that the changing of the collagen denaturation starts around 57, 60 degrees until 75, 70 degrees. So this is the right temperature that we have to perform, that we have to create under the skin. Again, the endolift from histological studies works around 60, 65, 70 degrees. So this is the right temperature measured by scanner and histological studies. Again, also the microfocus ultrasound with vision has reached the same temperature under the skin, but not outside for sure. This means that the effect and the result that comes from the endolift procedure and for the microfocus ultrasound doesn't come for the fibrosis, as happened in other technique. Comes for the skin rejuvenation, because most of the collagen that is produced after 4 to 6 months is a young collagen. So this is important because we don't want to create fibrosis. We want to create rejuvenation of the skin, for sure, and with endolift we can perform. But the temperature measured from outside never exceed the 40 degrees. So the 1470 nanometer is the right wavelength to have less power and higher effect also on the skin tightening. Endolift is very easy and have to be very easy. The fiber is easily inserted under the skin, no incision, no anesthesia. Under the skin, what does it mean? It means the hypoderma. Sometimes it's the middle hypoderma, sometimes it's the superficial hypoderma, but it's the hypoderma. So we are working on mainly for the face, the neck, submental, jawline, the neck, the barcode, the malar and festoon area to lift the eyebrow and many areas of the body. So the fiber is inserted under the skin in the middle hypoderma. Remember always to check with the pinch test the thickness of the tissue. That is important, as I'll show you later, when we have to choose the different fiber. And what happened inside? Inside, the fiber is inserted in the superficial middle hypoderma, shrinking and tightening the septum. So in this way, we want to shrink and tighten in a very easily way the septum. Then, for sure, there is the collagen biomodulation, there is the elastin and collagen production, so everything that can be done even with other procedures. But the shrinking and tightening is mainly given by endolift. The fiber are different available caliber, 200, 300, 400, and 600 microns in different shape. I mean, there is the old fiber that are the bare FTF fiber, means that the light emitted is frontal with an angle of 37 degrees. So this means that when you insert the fiber under the skin, you can work on what there is in front of the fiber. Differently, when you use the radial tip version, the radial fiber means that the light emitted is around the tip of the fiber, so 360 degrees. This means that when we're working with these, the area affected by the laser is about 1–2 millimeter. When we use the radial fiber, the area affected from the laser is about 4 to 5 millimeter. It's important when we are working in thick skin, when we work not in big skin, so where there is a lot of fat. But in most of our patients, the pinch test, for example, for the mandibular border is not more than 0.5, 0.7. So remember to choose always the right fiber for the right area. Why? Because if I insert the fiber in a very thin skin, I can affect the derma, so the patient can feel pain, or the fascia, or the muscular fascia, and the patient can feel pain. So mainly for the face, for the lower eyelids, we can use the bare fiber in normal thin patient. For the body, usually we use the radial fiber. There are two different techniques when I insert the fiber under the skin. There is this continuous fan technique. This means that the fiber is inserted under the skin and we give the energy in continuous, moving the fiber 0.5–1 centimeter for each second. Differently, we use also the dotted fan technique. This means that the fiber is stopped every 0.5 centimeter, giving the energy, creating something like column of contraction for the skin. So you can combine the different technique when you perform endolift procedure. As I told you, the pinch test is very important in order to choose the correct fiber when you want to perform endolift, especially in delicate areas of the face and the neck. So when is less than 0.5, 0.7, use the flat mainly. When you use the 0.5 over 0.5, 0.7 millimeter, you can choose the ring or the flat fiber. I have a little bit of experience on endolift, so it's many years that I performed this kind of procedure. Those are the kind of results that you can obtain, and many doctors continue to perform endolift and show me amazing results, as before with the lady that is in front of us, but amazing result with endolift technique. Even this kind of result that I am a surgeon, so I love to do surgery in my life, but the lady cannot perform surgery, and she obtained a nice result even in the platysma band. So it's sometimes medicine is not mathematics, and you know, result can come even when you don't expect so beautiful result. This is another nice result that I performed in a live few years ago. Again, for the neck, I show you also some pictures from colleagues from all over the world that send me the result after the procedure. So even for the hands, for the lower eyelids, this is for the festoon. That is an area very difficult to be treated for sure. Even with surgery, it's not easy to achieve this kind of result. But remember, as we said this morning during the live presentation, and later on we are going to do again, the most important thing is that when you work on festoon, doesn't exceed with energy. So work in a very light way when you work in the festoon. Don't use more than 50, 20, 30 joules. That could be enough, because when the swelling comes in this area, it's very uncomfortable and not easy to be fixed, for sure. Again, this is another nice result from the lower eyelids remodeling. And where we work in the lower eyelids? In the lower eyelids, you know that there is the skin. The skin is attached to the orbicularis muscle. Under the orbicularis muscle, there is the fascia. Under the fascia, there is a slight, teeny area of fat. Then there is the septum. So never go under the septum. Don't pass never through the septum. So if you want to work in the lower eyelids, you cannot work directly in the bags, for sure. You have to work in the preseptal area, where you can work in a very safe zone, where you work with the cannula, with different procedures. So you know that this is the area exactly where we can work, under the orbicularis muscle, up to the septum, so in the preseptal area. There are other areas that probably are not the best to be treated, but sometimes you can push the indication, absolutely. For example, the area of the marionette ring called the barcode is not the best area. I prefer to inject hyaluronic, absolutely, but you can even work in this area, obtain some nice results. Going through the body, you can obtain after 1 year also the nice result in skin laxity of the abdomen. Again, the remodeling of the ankle, that is a very nice indication for this technique, or again for the knees. So you can use 2 different entry points and remodel the area of the inner and upper knees. That is another area that patients start to ask, not start, it's many years that they ask, but start to ask more and more frequently. Absolutely. Those are some kind of results that you can obtain for the knees. Sometimes you can combine it also with different technique, with injection of hyaluronic, with microfocus ultrasound. So there are with threads. So it's nice to combine always endolift with other procedure, because the synergy of procedure can give you the maximum result. Which is the end point of endolift? Is not the total joule delivered. In the manual, I wrote the average of the total joule delivered for sure, but it's not the main endpoint. So it's not that we have to perform always 300 or 500 joules for the mandibular border. The first endpoint that is the changing in the shape of the area. The second endpoint is the changing in the consistency of the area. So when you touch the area, you can feel and you can see that immediately there is something changed. This is a good endpoint. The third endpoint, for sure, is the totally jowl derivative. And in the manual, there is an average for each area. For example, you can see for the lower eyelids is around 80 to 100. That's the average. Sometimes I work to 60 to 50. Sometimes I work to 150. So that's the average. But don't consider strictly the totally jowl delivered. Honestly, I don't care about the jowl delivered. I care when I have to work in symmetric areas. For example, if I work in the right area with 300 joules, I give around 300 joules to the other side if there are no asymmetry. The laser. The laser is a new model, so it's possible to upgrade in remote. You can export data. You can connect to internet and check even in remote from all over the world with the main company. So it's quite easy to also to control how and if there is some problem in the laser. With the laser can be used for the laser-assisted liposuction, for endolift, but you can connect to the same laser also a fractional scanner performing a fractional non-ablative skin rejuvenation. The 1470 nanometer is the correct wavelength also to perform the treatment of the safina. So you can use the, for the vascular surgery, you can work on the safina. You can use also for general surgery, for hemorrhoidectomy, for fistula, anal fistula. In gynecology, we are working with a lady lift. We call it the lady lift instead of endolift because it's a rejuvenation of the vulva, vagina, and the treatment of the initial and urgent urinary incontinence. Or also for photobiomodulation, I'll show you later. Those are some results that we obtained with the lady lift procedure. There are 3 different handpieces. There is the for inside the vagina, there is the outside for the vulva, and there is the surgical device. For example, the why lady lift? Because is another option respect the aggressive and ablative treatment that are from other lasers. So we can have a non-ablative laser, and there is a nice rejuvenation, and some patients feel pleasure during the procedure. Sorry, not after the procedure. Feel pleasure after, during sex, after the procedure, for sure. Sorry. I mean, because some patient comes because they cannot do sex anymore, so they feel a lot of pain. And after the procedure, they can exactly receive some nice result in order to obtain sexual pleasure, for example. This is a study where demonstrated that over these 15 patients, there is at the baseline a 10% of feeling, after 4 weeks 50%, and after 8 weeks 95% of pleasure. Again, for the vaginal atrophy, so there is an increase in tone of the mucosa, for sure, that comes around 90% after 8 weeks, after 3 sessions of follow-up. And again, for the urgent urinary incontinence, so we have to work in the deeper part, and we can perform a nice procedure for the patients. In conclusion, there is a tightening by precisely and safely heating the mucosa and the underlying tissue. There's no anesthesia, no downtime. The patient can come back immediately to the normal life. It's customizable, so we can consider the setting for each patient, and use it for various gynecological indications to improve patient's quality of life. As I told you, we can connect also a fractional non-ablative scanner, so to perform a fractionally non-ablative rejuvenation of the skin, for sure. And usually I combine the fractional non-ablative scanner, so in combination with the endolift. So first I perform endolift, and then I perform the fractional non-ablative scanner. Here I perform also the 532 diode for the red vessels. Again, I told you the endovenous laser ablation that is perfect for this laser, or hemorrhoidectomy, anal fistula, wounds, ulcer. We can use also with the external bell, so we can perform a photobiomodulation. We create a cosmeceuticals, so cream and serum, tested from the university, that can be used during the procedure, and they are called the endolift procedure. Again, there is the ILT procedure, so the interstitial laser technique, that is called the Marangoni technique because the founder of Euphoton have the idea to create this technique. But later on, Dr. Basil will show you amazing presentation, amazing result about this technique, so I don't want to lose my time. And your time, sorry. Again, there is the surgical handpiece, so you can insert the fiber inside the handpiece, and you can do the incision for the skin incision, for example. Here was a cyst of the hair area, and just there's no bleeding, as you can see, so it's very fast and easy procedure, and the cyst exit immediately from without any bleeding and any complications. So it's something that can be used also in this technique. Again, there is the lasers with ablation, so for the axillary hyperhidrosis. So performing in local anesthesia, we can do a procedure to treat and destroy the eccrine glands. The fiber in local anesthesia, as you can see, then the fiber is inserted inside a small cannula, and the procedure is done in an easy and faster way. As you can see, the minor test performed after 1 month demonstrate that there's no anymore presence of eccrine glands. Endolift can create also some troubleshooting. For example, mainly there are 4 indications or 5 indications you have to consider. Cutaneous injuries, but later on I'll show you that there's no cutaneous injuries with the endolift, but in case some redness lasts, especially when we enter inside the skin with the emission on, just cool the skin, shooting cream, and sunblock 50+. Again, sometimes we can create not vascular injuries, but some bruising for sure, especially when we work frontally to the masseter area or close to the mouth of or the nose or the mouth. So in some areas we can sometimes create some small bruising, but again, is not a real complication. The main problem can come regarding the nerve injuries. I mean, there is the sensitive problem that can come, but mainly paresthesia and hypoesthesia. So people can feel in 20–30% of cases for some days, mainly for some weeks, something tickling, but it's nothing visual, nothing that can create any problem. The problem can come when we are too close, for example, for some branches, so superficial branches, and can create, for example, neuropraxia. Neuropraxia who perform facelifting knows very well how to approach, and we can use the same therapy that we use for this kind of problem that is happened much frequently during the facelift procedure. Nowadays, we report worldwide probably 8 cases of nerve injuries, temporary nerve injuries. Everything that can happen after endolift is temporary, so nothing for the life, fortunately. And the 8 cases, 7 of them are done when the procedure is done under local anesthesia. So I suggest you to not use local anesthesia during the endolift procedure for 2 reasons. First of all, when you perform anesthesia, you create more target for the laser. So the laser energy can be spread on the anesthesia and not on the tissue, so you can lost your effect. Secondary, the spreading of the energy through the local anesthesia can affect the nerve, so you can be much risky for the nerves. But you know this, if you want to perform a dry anesthesia, a little bit of local anesthesia, do it if you want. I never done. In the 16 years, even this morning, we have done a procedure that the patient feel a little bit for sure. It's not that the patient doesn't feel anything, but it's about 3.5 over 10 regarding the pain for the procedure. And again, the last, but not the least, is the fiber breakage. So it's something that is built, constructed from a company. So it's important to do the stress test before to use the fiber. So just put around your finger or create a note on the fiber. If the fiber remains safe, is a good fiber, so you can use it without any risk. If you check other fiber from different companies, you cannot at all do this kind of stress test. But again, it's a good thing to do it, so in order to be sure that the fiber is the best fiber that you can use. Again, there are reported nowadays 3 cases of rupture of breakage of the fiber, and it's easy to feel the fiber under the skin and to remove the fiber if remain under the skin. So it's something that can be fixed. Only one case from a very good friend of mine that he treated the inner arms of a lady, a very maybe the lady received the threads and microfocus ultrasound, so different energy, and was a little bit too fibrotic. He used maybe a smaller fiber, and a little bit of fiber is still inside the patient, but it's invisible to X-ray, ultrasound, RMN. So there's no problem about this patient after 3 years and a half. And the last is the edema and the erythema that sometimes happen, especially in areas like the lower eyelids, the under chin. So edema, erythema can last for a few days sometimes, but this is after 2 hours. But if this is the result after 3 months, I can tell you that welcome a little bit of edema and erythema. I want to talk now also for some patients that have small holes of cellulite, a little bit of extra fat, a mild skin laxity. So which is the solution? We can combine a different technique with the same laser. So I perform the laser subcision, so I enter inside the holes directly with the fiber, disconnecting the septum from the skin, like Selfina, for example. So there is the release of the skin with the fiber. Then I use the fat removed from the culotte de cheval inside, so for a fat transfer inside the holes, and I perform also the endolift procedure that can be called also buttocks lift, so with 2 entry points working in the quality of the skin. And this is the result after 7 days. I mean, all the holes are reduced, the area of the extra fat is remodeled, and the quality of the skin starts to be the best that is possible. So as you can see, there's almost no bruising, because one of the effects of the laser liposuction is that it doesn't affect the vessels. So the quality of result will be faster for sure after laser liposuction. This is the procedure when I perform the subcision with endolift. So this is another patient for sure. So I ask the patient to contract the buttocks, and I want to remodel the whole area of the buttocks. So with 2 different entry points, creating some fun, with a fun technique to shrinking and to remodel the whole skin of the area. Then I ask to the patient to contract the buttocks, and I drew the depression of cellulite.